Hey y'all, so this is Dr. Tasha. And anytime the girl is a little bit under the weather and I'm coming to bring this video, it's because it's so needed. It's so needed. Y'all know my attitude is I'm always trying to solve a problem. Be it with my medical practice, which is Atlanta Premier OBGYN in Atlanta, or with my product line, which is Clean and Cute. And it's not just products. I'm really out here like it's about problem solving, right? And that's such a big deal for me. And so I'm looking at these videos, right? And y'all are getting dragged. The dudes are getting dragged. The women are getting dragged. And it's about everybody stinking. Why are y'all stinking? Like, what is happening? I know they sell soap. They even sell soap at the damn dollar store. Why y'all out here musty and crusty and sour? What is going on? Okay. And so I have to, at this point, look and say, maybe my generation did a bad job at home training. I don't know. I will take it. I will take it for the Gen X's. Because y'all millennials and Gen Zs, y'all playing. What is happening? Y'all playing too much. So it's a couple of people who I want to come to the front of the classroom because I'm about to get it together for y'all. Now, I did a video. It was months ago, and it was how to properly clean yourself. If you did not watch that, when you're done watching this, please go and watch that video, okay? But I'm about to bust it down. Y'all about to get the bust down. Y'all about to get to bust it down in this video, okay? Now, it's a couple of people I want to come to the front of the classroom. If you know that you have body odor, it's okay. We're not judging you. We're not shaming you. God willing, we're going to help you today. Come on to the front, okay? If people kind of do like this when you start talking, your breath stink. You come on to the front too. If you don't have any problems cooking, you feel like you can cook, but everybody keeps telling you, no, we cool, just bring some ice when you come, and some plates. Your kitchen ain't clean. You come on to the front too, okay? Because we're going to talk about a lot of different stuff today. And just everybody else, get in where you fit in, okay? So sit, get relaxed. If your feelings are soft, log off, okay, and go somewhere else, because we're gonna dig into this thing today, because as the seasons are changing, and it's changing rapidly. We was 50 degrees last week. Next week we're gonna be 95 and some change. So as things are changing, we don't want to be offensive, and we don't want nobody to damn offend us, okay? Ain't nobody got time for all of this. This is stuff that we have been taught and we should have addressed in middle school. But it's okay. Like I said, I'm here to fix the problems. Now, when we talk about cleanliness, y'all, please, can I please tell you guys that I don't know what's happening. There are no real gimmicks. There are no real quick, there's no product. We're going to get into all of this, but soap and water, okay? I want y'all to write that at the top of your paper. If y'all somewhere taking notes, you see my pen, because I had to write out the order in which to have a conversation with y'all, because I'm confused as to the problem. So what we're going to say, from the gate, right at the top of your paper, maybe even a little bit to the right, go ahead and write soap and water. It's okay. Just soap and water. You're going to see, because I'm going to keep referring back. So you're going to, okay. Now, the first thing I want to really address is understanding that, and I want to be, I'm being funny, right, guys? Because, this ain't health class, although, hell, y'all making me feel like it should be. This ain't really health class, so it's not you got to be, we can make light of the situation, because you're either watching this by yourself or with a friend. And take this opportunity to passive-aggressively share this video with somebody who you just want to let them know you ain't fresh. You're not fresh. You're sour. Go ahead and share this, okay? It's a passive-aggressive move. Now, I do want to say that there are, in every situation I'm going to talk about, and I'm going to try and hit this, I want to be clear that there are some medical conditions that some people have that a lot of you don't realize are medical conditions, or sometimes you don't really realize that people are going through things. So I'm making fun, I'm making light, and I'm making fun, but please be mindful of other people's feelings and show people grace, because by the time somebody else smells them, trust me, they smell themselves. And it's either they can't do better, they don't know how to do better, or something is happening, right? And so in a situation like that, it's not really a time or a chance to poke fun at people. If you truly love that person and you care about that person, maybe you want to have a conversation where, you unarm yourself and say, hey, listen, let's talk. I'm noticing this, and I notice it's not generally like how you roll or what you do, or so is something happening? Like, open yourself up and give somebody grace, and they may just bust out crying. You guys don't understand how many patients that I see, they come from across the country to see me for me to fix certain conditions. They're 8-10 years in, not having sex with their partners. They don't go anywhere. They've isolated themselves because they smell themselves. Nobody can tell them what's wrong with them. Nobody can tell them how to fix it. And it's literally sent me back to the textbooks to be like, bam, and to learn about certain conditions. And I'm just like, well, damn, like, and it's taught me a lot. So please don't feel like if you smell somebody that they're purposely being offensive, because it may not be something that they can help, and you wouldn't want somebody to do that. People have gone to human resources on other people about conditions that they can't change. They've lost their jobs. So, guys, just care about somebody else's feelings. Don't think it's funny, and don't go clowning because you can. Like, the best thing to do is to love up on somebody and help them if you can. And if they don't want the help and they stay being ornery and, they stank, then be like, well, go ahead with your stank ass. But otherwise, just, let's try and love up on each other, okay? Now, the first thing I want to talk about is because it's a mentality of stop perfuming things away. Stop covering things up. Like, let's get to the bottom of why things are happening. One thing that I want to start with is skin, right? Because I'm noticing a culture of so much freaking makeup, and we'll talk about, my stuff, but I'm noticing a culture of so much makeup, right? And guys are complaining that y'all are leaving this makeup on their pillowcases, y'all are doing this, they always got something to complain about. But whatever, the point is just that, some women just love a lot of makeup. They love the aesthetic. They love the way they look with it, and that's fine. But if you're somebody who's covering imperfections, you're covering hyperpigmentation, you're covering acne, you're trying to cover whatever it is with skin stuff, a lot of health issues will come out and manifest in your skin, right? And so even for me, like, when I'm stressed, I get like the worst acne. And that, as a real grown at this big age, yes, when I'm stressed out, I get acne. And when I get acne, it leaves me with hyperpigmentation. And it drives me absolutely bananas. And I would never step foot out of the house with hyperpigmentation. And I have a little here and a little here that's like 90% gone. Genetically, like, I have dark under eye circles. I don't care what I do. I don't care how many peels I get. And I'm always going to have some concealer for that. And so I wear concealer, and I cover these spots up with concealer. Anything else, I generally do not wear. All this up here is not eyeshadow. It's just the natural darkness of my eyes. I get my brows waxed, mascara, and a little lip stuff all the time, but I don't wear heavy foundation. I don't wear heavy makeup. I just choose not to, but that is my personal choice. It doesn't have to be yours. But when it comes to skin, even if you choose to wear a lot of makeup, let us get into cleaning our skin, and not just like the skin on our body, clean yourself, clean your skin. Find a nice cleanser and a nice moisturizer. You need that at the very minimum. What helps hyperpigmentation? Chemical peels. Get a chemical peel. Get medicated creams. Get some serums. Start looking into things that are going to help your skin. You can still wear makeup if you love makeup, but clean yourself so that if you decide, I don't want to wear makeup a particular day, throw on some sunglasses and some lipstick, girl, and you are good to go. I'm not saying makeup is a problem. I'm not saying that if you wear makeup, you're trying to cover something. No, you can just simply love the way you look with makeup. But as for anybody else, male, female, teenage, older, younger, please clean your skin. If you're not sure what to do, find an esthetician. They will kind of go over your skin. They'll do extractions, meaning they'll pop pimples. They'll clean your skin. They'll give you some regimens. They'll tell you some things to follow. If you can't afford to buy the stuff they're telling you to buy, baby, you said, I need vitamin C. Baby, take yourself on the Amazon, well, not the Zon, but take yourself into one of these places. Nicole Murphy has a good one for vitamin C. She has hyaluronic acid. You can find a bunch of Black-owned estheticians with small businesses where you can take your routine and not necessarily spend a lot of money, but still get into a skincare routine. And also, one of the most important things when it comes to anything I'm going to tell you, anything you have going on in your body, any medical conditions, anything that is going to potentially build odor and make odor emit from your pores, because skin, water. Alkaline water is going to be the best kind of water that you can drink, because disease, no matter what the disease is, it cannot live in an alkaline environment, okay? So alkaline water is always going to be the best, my baby. So drink water. It is going to clear your skin. Those little fine, itty bitty little bumps y'all be having, that's sugar. That's sugar. Hydrate, baby. Hydrate. So you can get that skin on a good situation. I'm trying, baby, me personally, honey, I'm trying to clear up these last little few things so I can shine this thing up, baby. I wouldn't want to go outside with Vaseline on my face and some sunglasses, honey. But that's my journey. All I'm saying for you is clear that skin by cleaning that skin. Just make sure it's clean. Why not? Why not? And when it comes to skin, let's get to y'all's linens. If your pillowcase is supposed to be white, and I ain't gonna name no colors, but if it's supposed to be white and it's not, problematic. If it's supposed to be yellow and it's not, problematic. It's supposed to be cream and it's not, problematic. Okay, because think about this, all the stuff that's on your hair, whether you have a bonnet on, whether you wear a scarf or whatever, all the oils and stuff, oh yeah, that's on your pillowcase, and now that's on your skin. When it comes to detergents, you guys know I have the Clean and Cute line. We have a home line. I'm very, very particular about that because that's all natural. If you don't want to use mine, I don't care, okay? But I want you guys to find a detergent line that is truly all natural. Read the ingredients on that bad boy, because most of the detergents, not only are they chemical based, they are bad for the environment, and they're also mostly cancer causing, interestingly enough. So don't be afraid to read the ingredients on that. But if you're interested in clearing your skin, you can't use a bunch of chemicals and fragrances and all these like mainstream detergents on your linen and then put your face on it and then think you're not gonna have acne or hyperpigmentation or breakouts or allergic reactions or all types of stuff. So you have to be very, very cognizant of not only what you're putting in your body, but what you're putting on your body, okay? So skin, that's a big one, y'all. Please, please, please. And a lot of times it's like, you know, I don't know, maybe it's just me, but you can really tell how clean people are based on, people may have skin imperfections, but you can tell when their skin is clean. You can tell. And so please make it a point to clean your skin twice a day, in the morning and in the evening. Just consider it, okay? The next thing I want to get to is the mouth. Child. Now, if you know anything about me, I am obsessive about whitening of the teeth, how white my teeth are, blah, 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 blah. And I think because the mouth speaks a lot to your cleanliness, to your overall cleanliness. The mouth speaks a lot. I talk a lot. I talk to people all day. I talk to y'all, honey. I talk to the friends, the family. I talk, okay? We don't need, you know, nothing necrotic coming up out that mouth. Now, the best thing you can do is go to the damn dentist. Make sure you're going to the dentist. Get your stuff clean. Any cavities, that thing is going to smell terrible, okay? Make sure you're getting your teeth clean. Do the best you can do. If you got some stuff going on, you can't afford to see a dentist right now, it's cool. Get you some oral, not regular peroxide. Get you some oral peroxide and gargle with that oral peroxide and spit that thing out. You cannot swallow it. You kill yourself. Gargle with some oral peroxide. It's hard to find. A lot of times they have it at CVS, I think. Walgreens, CVS, one of them. But oral peroxide, make sure it will say on the bottle. How do I know it's oral? It will say it. oral peroxide, okay? Gargle with that thing. It will kill like a lot of bacteria and a lot of infection that is in the mouth that maybe you can't get addressed right now, but the oral peroxide will really hold you over, okay? Make sure you are brushing your teeth, your tongue, your cheeks, your gums, the roof of your mouth. Brush everything, okay? Brush that thing at least twice a day. Please, thank you. Now, when it comes to mouth stuff, I want y'all to also be cognizant. Did y'all know a new article just came out showing that our young population is really starting to have a lot of mouth and throat cancers? And y'all know why that is, right? Yeah, because y'all nasty. No, y'all not nasty. But because of the bust down, like y'all are the oral sex. The oral sex might be a little bit out of control. Y'all ain't asking enough questions. Y'all just going down on people. Y'all just swallowing. Y'all doing all kinds of craziness. And that HPV is getting y'all, baby. And that HPV is festering and growing. Y'all, again, ain't going to the dentist. Ain't going to see these doctors. And it's festering and growing up in her. And we having all kinds of problems. So please, again, everybody's insurance ain't tight. Some people be having stuff. I get it. Y'all know I'm a doctor. I see it all the time. But if you can, make sure you're brushing your teeth, tongue, all of that. Oral peroxide, oral peroxide, oral peroxide, please, okay? And if you have a lesion in your mouth that won't heal, like an ulcer or something, it just always seems like it's raw, it just won't heal, you need to get that looked at. Get that looked at. Go to the emergency room if you have to, but get that looked at, okay? So normally if you're brushing your teeth, now another thing that I have noticed over the years is that, interestingly enough, when you have issues with your colon, that's going to come across as bad breath. A lot of times it may be chronic constipation, and like when you burp, it smells like doo-doo. When you get dehydrated, because dehydration too can cause you to have bad breath. So make sure you're drinking enough water. I'm telling you, water is going to be the key to most of this, but make sure you're drinking enough water. If you notice you're like, I don't know why, every time I burp, every time I belch, it just smell like doo-doo. It just, that's further down in the colon. You got something going on. You need to get a colonic. You need to get a colonoscopy. You need to go see somebody, okay? Clear that out. It is so important that we keep our GI tract cleared out, because a lot of odors and a lot of stuff, it comes from your GI tract. So I don't know if that's going to be a parasite. I don't know if that is going to be an infection like H. pylori, E. coli. Baby, y'all got to get that poop about you. One, it'll help you lose weight. Two, it'll prevent you from emitting funny odors, and that's especially through your pores as well as through your mouth. Get that poop up out of you, okay? Like, seriously, like, I'm just saying. So yes, it's not just all dental. Like I said, if you're doing your dental stuff, if you got sores in your mouth, you need to address that. Oral peroxide. Make sure you're brushing your teeth. And then if it's just like, I don't know, something else, then you need to start looking deeper. And I always say, start with the colon. Okay. All right. Now, let's get to this body. Yada. Y'all on here talk about people smelling like the backs of earrings, talking about people smelling sour. I don't know. Like, I don't know what it is. I don't know why. Like, not very many of my patients have BBLs. Maybe I've seen maybe like 2, maybe 3. But I have a handful, like literally less than like a handful of patients with the BBL. So when y'all talk about the BBL smell, when I was like, is this real? I was being serious. Like, I be reaching out to y'all like, what's in these streets? What is actually happening? Because girl, let's talk about overall hygiene. Again, part 1 gave a lot of information, but again, I be looking at these videos, and sometimes y'all be doing like little surveys like, do you wash below your knees? Do you wash your elbows? I mean, it just be stupid questions, right? But at the end of the day, it's really not stupid, because a lot of people was like, what I gotta wash below my knees for? Like, the water gonna rinse down there. And I think even like this famous comedian lady said the same thing, like, what I gotta wash below? First of all, how damn lazy do you have to be in the shower with soap on your washcloth? You done washed your whole body, But you get to the knee and you like, that's enough. Why? So the bottom of your leg don't have dead skin? The bottom of your leg didn't sweat in your pants or your boots or your socks? Like, so staph and strep are not on the bottom of your leg. Now, staph and strep normally live on the skin, which is why we're going to be very careful with what we wash with as well. And we're going to get to that. But why would you stop? Like, and so y'all washing y'all arms and you washing your armpits. But what's wrong? What the elbows do to you? So stuff didn't, you might have went to Juicy Crab and stuff was running down your arm. I don't understand the language that y'all are speaking. Now, when you get in the shower, please wash everything and lift up your foot and wash that too. And in between your toes, because that's nasty. And what we don't want is athlete's feet. And again, we're having a discussion. We're not judging anybody. We're having a discussion. Maybe your mother didn't say this to you. Maybe you didn't have a mother. Maybe, you just didn't have a maternal figure to help you with this, and that's why I'm here. Okay, so don't feel judged, don't feel implicated, don't feel like I'm making fun of you. I'm making light of the situation, but some people really need to hear this. Okay, lift up your foot, wash the bottom of your foot, and wash in between your toes, because what we don't want is athlete's foot. Okay, yes, I want you to wash everything from here to the bottom of your feet. Everything. Now, I think that there's some confusion sometimes as to whether we should or shouldn't take a bath. To take a bath or not to take a bath. Now, let me be very clear. Are y'all listening? Come on, girl. Come back in here. Come back in here from the kitchen. Come back in here. Hurry up and pour your glass of wine. Hurry up. Hurry up. Should we take a bath or not? A bath is okay. You can take a bath, okay? Now, you can't put nothing in your bath because all of y'all, and it's crazy, I be seeing y'all TikTok influencers, ooh, I need a bubble bath. I'm like, ooh, you got vaginitis. So, nothing in your bath water, and I don't care how natural you think it is. If you're putting stuff in your bath water, you got vaginitis, okay? If you're squeezing the shower gel in your bath water, you're not supposed to be using liquid soap anyway. You know my rules. You got vaginitis, okay? Boom. So stop leading y'all followers into these bubble baths because you're leading them down the road of getting an antibiotic and smelling like, because they're going to get vaginitis. Now, so a bath is fine. Just nothing in the water. Just get in some nice warm water. Okay. Some people are like, ooh, you stewing in your own dirt. How dirty are you? But even if you're stewing in your own dirt, if you feel like you want to stand up after your bath and take a shower, that's fine too. Do that. But you can actually soak your bottom. You can soak your bottom in water. It's okay. And that might help some folks. Okay. So that is a very big one. Now people are like, well, I don't know your rules. I don't know your rules. And I always think that it's the same 10 good girlfriends on here. But if you have not heard me talk about vaginitis, please go back and look at these YouTube videos because I bust it down. I break it down. Okay, vaginitis slayer over here. So let me talk about the hygiene rules. Since we're talking about hygiene, let me talk about the hygiene rules when it comes to vaginitis. You can agree, you cannot disagree. We're not gonna squabble in the comments. What I can tell you is there's nobody in my practice who has recurrent vaginitis. People are like, I love my boric acid. I love it. Well, why are you still using it if it works? Because if it works, you're supposed to use it and be done with it, right? Okay. So all the stuff that you're continuing to use, it ain't working. But that's just me. I don't want to squabble. I'm telling you what I tell my patients. You can eat the meat and throw away the bones, okay? Now here we go. When it comes to hygiene, never shampoo your hair in the shower, okay? Never use liquid soap of any kind. I don't care who made it. I don't care how natural you think it is. I don't care what. Don't come at me with the rules as though you live in the jungles of Ecuador. You don't live in the jungles of Ecuador. These ingredients didn't come from the jungles of Ecuador. You just had lunch at Chick-fil-A and now you want to come to me like, oh, it's so natural. Miss me with it. Okay, so what we're not going to do, we're not going to use any liquid soap. I don't care who made it. No perfume soap, no deodorant soap, no feminine washes of any kind. I don't care, refresh, pre-fresh, defresh. It does not fix your balance. Only an antibiotic can do that, sadly enough. None of all of that stuff, okay? Not. Now, There are only 2 soaps that I co-sign. Yes, these are both bar soaps, okay? Only 2. One is my soap, the Clean and Cute Body Wash Bar, but I'm not that doctor, because you got some of them on this internet that are going to tell you you can't get healed unless you use their product. No, I created this soap. It's a natural product. It is all natural. It only has 5 ingredients in it. It kills staph, strep, bacteroides, which is one of the bacteria that cause acne. It helps with hyperpigmentation, stretch marks. It helps with athlete's feet. Some people even say it decreases your discharge. I don't know. I'm not co-signing all that, but that I snapped on that thing. But I created it about 4 or 5 years ago. Before I created it, 20 years into the practice, I would tell my patients Dove White Bar. Sorry, girl. Had to click back over. The original, the OG, the Dove White Bar Soap. Not nothing fancy, not the exfoliating, not the sensitive skin. No. The original, the white and navy blue box, the OG, okay? And yes, I don't know who been telling y'all don't wash down there with soap. Please do. And your booty too. Now, when they say don't wash the vagina, you know the vagina is the hole. Like the vagina is up inside the hole. Yes, please don't go up inside that hole with nothing. That hole is for tampons, dildos, fingers, and that's it, okay? Do not go up in that hole for any reason with anything other than a tampon, a dildo, a finger, or any applicator for any medication you got to put up in there. Do not do it, okay? But the outside is fair game. Please lather up a wash rag and get to work. Get to work. Sometimes the stuff I be seeing caked up around there, I'm not surprised y'all got infection. The stuff I see caked up in there, and then rinse it out, rinse it out, and then lather up again. And then go to the booty. Now start from the back of the vagina, which is the front of the booty, and swing it all the way up to your back, to the crack of your back, okay? That's how you're going to clean your booty. And do it a couple of times. Don't be scared. And then rinse that out, okay? So for every part of your body, in my mind, you use some soap for your upper body, all this, then rinse it out. And then you get some more soap, and you use some soap for the coochie, and then you rinse it out. And then you use some more soap for the booty, and then you rinse it out. And then you get them legs and them feet, okay? Like that's what we want to do. Now, it might seem like a lot of work, but the benefit is that you don't smell bad, okay? And you can do that a couple of times. You can do that a couple of times, 2, 3 times. 3 might be overkill. 2 times is perfectly fine, okay? And that's how we want to address actually washing the body. So yes, you can take a bath, just nothing goes in your bath water. You a special kind of person if you get in a nice warm bath, but you can't relax because you ain't got no bubbles. Girl, grow up. Girl, grow up. Get you a bubble machine and have it. They got them on Amazon, I think. And you can have the bubbles blow out in the room. Have some bubbles like that. But in your water, you will end up in the office with 7 days worth of antibiotics. I'm just saying. Just don't do it. Don't do it. So yeah, that is how we kind of want to. Now, let's talk about body odor. You know, I had somebody and my heart broke for her because, you know, she actually sent me, like, she had me throw the glasses back on at the house. I don't do that. She had me throw the glasses back on at the house. I had the old lady reading glasses on, like the ones you sit right here. And I was in this thing, like I was in the book, because she was basically saying, like, everybody just, she walks up and people kind of just walk away like, ooh, what is that smell? She's like, I've been treated a million times for vaginitis. I've been treated for this. I've been treated for that. It's not this. I've been to the dentist. I had a colonoscopy. Like, it was all the things. And this is the patient who I learned that there was truly a syndrome called fishy odor syndrome. No cap. Like, this is really a thing. And if I can explain it, like, real quick, this is it's like there's an enzyme in the body that your body makes, and it smells very fishy. And there's another enzyme that kind of attacks it. And what happens is when you have fishy odor syndrome, the enzyme that attacks it, your body doesn't make. So what everybody is smelling is that enzyme that everybody has, but everybody else has the enzyme that attacks it. And these people don't have that, right? So it's just an overwhelming sense of fishy odor. and it actually is produced in the gut. And it's just so bad, right? And it's just kind of emitted through the pores. They feel like when they go to the bathroom, when they poop, which would make sense because it's manufactured in the gut, they feel like every orifice, everything just gives off the fishy odor. And I had to go in the lab about that because I didn't really even know about it. And because I'm going to learn some stuff for you, I'm going to get something figured out. What you ain't going to do is come to Dr. Tasha and leave without a solution. And so I learned about this and learning that, yes, they need antibiotics, but they need activated charcoal. They need a couple of other things. Like I kind of got this lady's regimen together and she's fine. She's doing better. You know, she's saying that people are not shying away from her like they used to and blah, 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 blah. But that's why I say sometimes it takes grace. It takes understanding. And just listening to people and not always assuming that somebody is offensive and dirty and that being mean to them is going to make you feel any better. Because I don't like that kind of stuff. And like I said, I can clown and I can joke with y'all, but at the end of the day, we're not going to dwell on the problem. We're going to dwell in the solution. You see, I keep flashing my nails because they're real cute. Anyway, so, but yeah, so when it comes to the skin, it has pores. It emits certain things. So you have to be very mindful of the things that you're eating. Make sure you're drinking water. Make sure you're eating balanced meals. Cleaning the dead skin off of your body. And again, guys, I don't know who out in these streets changing these sheets once a month, once every 2 months. Baby, my recommendation would always be to change your sheets once a week. But if that's too much for some people, at least every 2 weeks. But because you were like, I don't have dead skin. You always have dead skin. You always have dead skin. It's fresh out the shower. We're emitting dead skin. Like that's how your skin cells regenerate, like continuously, and we're always shedding dead skin cells. And so those are on your sheets. It's like I get in the shower and then I put lotion on, baby. That's even a whole thing. Like, please clean these sheets, y'all. Please clean these sheets and be mindful. Y'all know how I told y'all about boiling that stuff. Be mindful about what you're cleaning. I mean, it might smell good, but all the chemicals that, you know, it's like, I got body acne. Do you? Or is it really an allergic reaction to all the chemicals in your detergent? My eczema is flaring up. I bet it is. So be mindful of those things as well, guys. And it's the small things that matter. Stop perfuming things away. Here's what I tell my patients, and we're gonna talk about these balls, guys. So I ain't past y'all. I tell my patients, if you had an infection in your tooth, and let's just call it an infection, and don't get fancy and cute. If you had an infection in your tooth, is there anything on the aisle of one of these stores that could fix you? An abscess, all that? No, you have to go and get it treated, right? If you have a C-section and you got some green stuff oozing out of your C-section scar, is there anything on the aisle at one of these stores that's going to help you? No, you got to go get that looked at. If you have a stab wound in your thigh and it's swollen, it's red, it's painful, and now it's oozing some stinking stuff, are you going to the store or are you going to get that looked at? Right. So when you have a vagina that's emitting odors, you have excessive discharge. The discharge is irritating, it's itching, it's burning. Why do y'all think it's something on TikTok Shop or at the store that can help you? I don't understand. I don't understand. So if we're emitting odors from the vagina, how about we not perfume it away? And how about we go and see what the actual issue and odor is? And if you continue to have the problem and whoever you're going to see is not finding the problem, you're like, I done took this antibiotic 20 times. Well, it does not take a weirdo to see that if you done took this antibiotic 20 times and you still got the problem, either one, that ain't the problem, or two, you on the wrong antibiotic. Like, find you somebody else. Y'all act like y'all got to stay put with this one terrible person that you're seeing. You don't. Find somebody who can fix your problem. Okay? Now, for the men, because I like how cute it is. Y'all make these cute videos and y'all get on here and y'all drag the women about, you know, their vaginal odors, and it can get complicated and it can be stanky. Okay, but a woman is mad when she drag you about your sour underballs. Okay, the underballs. So let's talk about that. Now, just like anything else, male sweat. I mean, we all sweat, okay? But y'all have a real interesting situation because y'all got a little vault, a little, you know, you got your testicles and or your scrotum or your balls or whatever you want to call them, and you lift up, and then you got a dark, sweaty area up under there, and y'all equivalent of yeast is what do you call this? Jock itch and, you know, yeast and cancer and all those things, and you're lifting up your balls, and then your balls go inside the toilet, and then I don't know if you got some hygiene stuff, you got doo-doo on your ball. Listen, okay? And then y'all get funny when people get particular. That's why people got throat issues now. They probably got E. coli all down there from the doo-doo that's on your balls. I don't know. Again, I don't judge people or their lifestyles. I just try to help people. Now, as far as that's concerned, when you're in the bathroom bathing, don't just wash, okay, No, you want to wash the entire shaft of the penis. You want to get in between the penis and the balls, and then you want to get up. Don't be scared to lift a leg. That's not sissy-ish if that's what y'all complain. That's not gay. That's not weird. It is clean. Lift up a leg and get up under there. Okay, if you gotta lift your balls with one hand and then wash with the other, get up under there. Ain't nobody got time for the cottage cheese, cream cheese, buttermilk. So y'all don't be getting up under there, right? And then when your boxers get all crowded up in there, and then you got the streaky deekies, it's problematic. Now, if you do got streaky deekies, and to keep the athlete's foot or whatever you call it, jock itch, all that, don't be scared to use Clean and Cute Men's. It too is all natural and smells like, I mean, you know how that new collection of Old Spice, we smell better than that. But it's like that, like your detergent, your underwear be busting. Like the ladies be like, oh, that smells nice. So don't be scared to run over and get some. But nevertheless, make sure you get up under there. Wash that thing. Wash it good. Now, ladies, interestingly enough, because a lot of women always have this question. So if he washed with body wash, is that going to give me vaginitis? No. Now, if he goofy and don't rinse off properly and clean off, and hopefully y'all got the handheld and he can get all up under there with the handheld, but if not, rinse off, my brother. Okay, so get up under there good, wash, and don't be scared. Just like some of y'all wipe one time when you do, and that ain't enough sometimes. Sometimes wipe until the toilet paper is not dirty. Okay, I don't know who needs to hear this, and I don't know. Okay, I don't know who needs to hear this, because everybody wasn't raised the same. But sometimes wiping one time ain't enough. Okay, you got to wipe, see what's going on. Don't clog nobody's toilet, flush. Get you some more toilet paper. Okay, wipe it again. When the toilet is ready, you know, because it got to run, the tank got to fill. When the toilet is ready, you flush it again. And I don't care how many times you got to do that until there's nothing on the toilet paper, okay? Because sometimes y'all are asking too heavy of a load, no pun intended, for your wash rag, because you got all the caked up doodle. How you know you got caked up doodle? Your booty be itching. Your booty itching. If you like, ooh, and you notice your booty itching, that's because it ain't clean. That doodle in there drying up, and it's just uncomfortable. It's uncomfortable. So make sure you're wiping good from the gate. Now, ladies, this is one thing that I'm big on in my practice. We do not do wipes. Causes vaginitis. But what we do is something called water wipes. And water wipes have no detergent. They have no soap to them. It is not going to cause you to have a vaginitis. Get your water wipes. Okay? Because that help you out, but it won't cause the vaginitis. All right? So hopefully that helps somebody in understanding how to wash your privates. Men get all up in there. And if you are uncircumcised, ladies tend to think that they get vaginitis more from males who are not circumcised. That is not true. But he got to be clean and understand how to clean his uncircumcised penis. Now, if he is uncircumcised, you got to pull the skin back and wash all around there with the skin pulled back. And then pull it up and then pull it back again. But you got to make sure you don't just clean the outside of the penis. You got to pull the skin back. It's stuff up under there. Lint, sweat, buttermilk. I don't know, but you got to pull it back and clean her off. Okay? Because, and then if your partner is uncircumcised, be attentive. Because first and foremost, if you look and you like, this ain't clean, first of all, your next move should be to get up. Because what that is a whole red flag. Because if that ain't clean, ain't nothing else clean. And I just don't see. But anyway, let me unfrown my face, because we don't judge. We listen, we don't judge, okay? Now, as far as the whole BBL thing and this, that, and the third, I don't know, y'all. Somebody said necrotic tissue. You can't really have necrotic, tissue back there without having issues, without having fever, without having general body aches and, all types of foolishness. You really can't. But I don't know. I mean, it got to be something to it that people stinking. I don't know. Is there some type of something maybe that they prepare the fat with, and that's getting I don't know. Don't even get me started. But the next round of podcasts, I think we're gonna have a plastic surgeon on, and so he can tell us about, or she can tell us about, what's happening, and why these people are perceiving that all the BBL booty stink. Because what's the purpose of having a BBL booty if it's gonna be stank and it's gonna be all this stigma and all the foolishness attached to it? That don't make no sense to me. So we're gonna get some real answers from a real surgeon and see if this is a real thing, or people just not cleaning their booties. Okay, so I hope this helps somebody. Again, go back into part 1, but I just wanted to hit y'all real hard on the cleanliness of it all, because this don't make no damn sense. We is grown out here. And some of us is big numbers, and people complaining that, the basics are not being met. Now, come on now. But anyway, I hope you had a good time, and I hope you learned something. And thanks for joining. It's Dr. Tasha. And don't forget, this coming Thursday will be a new podcast, and I'll be talking about in your 30s and you haven't started a family yet, what to do, what's the checklist, what's the questions to ask, what's the questions to be answered. It's going to be a real humdinger. So join me right here on YouTube, 7 p.m. this coming Thursday. Have a great week, y'all. Bye.